All right, welcome to the Explainer. Today we are diving into how AI is completely changing the game in medical imaging. If you need to get smart on this, and fast, you have come to the right place. So you've got an exam on AI in healthcare breathing down your neck? Don't sweat it. We've got you. The next few minutes are basically the only study guide you're going to need. Okay, so here's our game plan. We'll kick things off with a real patient story. Then we'll look at two major pieces of tech, an AI radiology assistant and a pocket ultrasound. After that, we'll boil it all down to the key things you have to remember, and we'll wrap up with what this all means for the future. To really get a feel for the impact here, you have to start with a real person. So let's talk about the case of Mr. John Smith. Honestly, this is a perfect example to use if you need one for your exam. Now check this out. AI jumped in at two absolutely critical moments here. First, during the initial diagnosis, it spotted this tiny little nodule that was missed before. And then, and this is huge, 6 months down the road, it caught a super subtle sign that the cancer was coming back, letting doctors get on it immediately. So the key takeaway here is that the AI wasn't the doctor. It was more like a super-powered partner. Think of it as that perfect second set of eyes that literally never gets tired or distracted, you know? It's been trained on thousands and thousands of scans to catch stuff a person might just miss, especially at the end of a long day. Okay, so what is this tech that made Mr. Smith's early diagnosis possible? Well, let's dive into our first major example, a company called Zebra Medical Vision. The easiest way to think about Zebra Medical Vision is as an AI specialist that's built right into a hospital's main imaging systems. It's basically an algorithm that sifts through thousands of X-rays, CT scans, and MRIs, and it flags the really urgent or suspicious cases for the radiologists. It helps them prioritize. And if you need to remember its key features, here they are. First, it's automated. It finds problems on its own. Second, it's super versatile, working across different areas like cancer and heart conditions. Third, it plugs right into the systems hospitals already have. And fourth, it's fast. We're talking real-time analysis here. All right, let's switch gears completely for our second piece of tech. I mean, this is a totally different way of thinking about it. If Zebra is about putting a turbocharger in the hospital's radiology department, our next example, Butterfly IQ, is all about taking that imaging tech out of the hospital and putting it right in a clinician's pocket. I mean, this is a total game changer, right? Instead of some huge, clunky, expensive ultrasound machine wheeled around on a cart, Butterfly IQ puts all that power onto a single probe you can plug into a smartphone. It's making medical imaging accessible in a way it just never was before. And its core features are pretty amazing. It's so portable you can use it in an ambulance or a clinic in the middle of nowhere. The AI is brilliant, it helps find problems, but it also gives you on-screen tips, which means even people who aren't ultra specialists can use it. Plus, it's connected, so you can zap the images to a colleague for a second opinion. The keyword for this one, accessibility. Okay, deep breath. Let's pull this all together. If you're really cramming and you only have a minute left, this is the slide you need to lock in. This is the exam cram summary. So here it is, the big comparison you'll want to remember. On one side, you have Zebra, which is all about supercharging experts in a centralized place, like a hospital. On the other side, you have Butterfly, which is about empowering pretty much anyone to do imaging anywhere, at the point of care. One supports the specialist, the other democratizes the tool for the generalist. But here's the thing. Even though they work in totally different ways, the end game is exactly the same, early detection. Because no matter what the condition is, catching it sooner almost always leads to better outcomes for the patient. That's the bottom line. That's what this is all about. Okay, so let's zoom out. What's the big picture takeaway here? What does all of this actually mean for the future of how we diagnose diseases? This is probably the single most important point, so really let this one sink in. This isn't about robots replacing doctors. It's about augmentation. AI is this incredibly powerful tool that complements a doctor's skills. It takes care of the tedious, repetitive stuff so they can focus on the hard problems and on, taking care of people. It makes a great doctor even better. And that leaves us with a really fascinating question to think about. As these AI tools get better and better and better at the seeing part of medicine, at just interpreting the images, how does the human expert's role change? What's the next level of expertise for a doctor? Something to chew on. Good luck with the exam.